Hi everyone, my name is Dr. Paulo Antônio Almeida. I'm a psychologist. I'm here to talk about the prolonged exposure therapy for PTSD. I did a great course from Pennsylvania University. They have a long traditional course in method about how to treat PTSD through prolonged exposure therapy. Is a method that people could confront their traumas, the scene of traumas, about the step-by-step process of they put their memories, their experience, their fears through this kind of methods. It's important to determine if you are candidates for PE, the prolonged exposure therapy. First of all, your trauma story, confirm presence and severity of PTSD symptoms, assess for presence and severity of comorbid disorders, confirm that PTSD is among the current primary problems. It's important for us as psychologists to do interview measure with PTSD symptom scale interview, self-report measuring, PTSD scale self-report, assessment of other disorders and symptoms like diagnostic interview for anxiety, mood, or OCD and related disorder, DIAMOND, self-report measures, back depression inventory, patient health questionnaire 9. When administering the PTS-5 and PSSI-5, we inquire first, it's important as psychologists inquire about any race or discrimination-based trauma experience. It's important in the section 1, ask about blame, responsibility related to the index trauma, ask if patient thinks race or group membership was a factor to identify for purpose or later processing. Acknowledge cultural difference between therapist and client in order to show cultural humility, and open the door to asking about how cultural background may have impacted the client's experience of the trauma. It's important for us to identify if you are a candidate for PE. Please send me a message through here Instagram, and you could do this treatment with me here. Dr. Dr. Paulo Antônio Almeida, send a message with your cell phone so I could treat you with this incredible method. I know, I sure you love this method. PTSD diagnosis is determined by counting the number of symptoms endorsed, a rate of 1 or greater per symptom cluster. You know, PTSD as post-traumatic stress disorder. It's very common in veteran war, and people suffer from sexual abuse or rape or assaults, something like that. We have a post-traumatic diagnostic scale for DSM-5, PDS-5, 44-item self-report questionnaire developed to measure the presence and severity of PTSD symptoms, include a trauma screen where respondents identify index trauma. First 20 questions assess PTSD symptoms, other questions assess interference, time onset, and duration of symptoms. So through this scale and this interview, we as psychotherapists could treat with you. It's very important to know the prevalence of PTSD varies by race, ethnicity, and ethnicity. US sample indicate higher prevalence and lower treatment use among some racial ethnic minority groups. Evidence suggests that there may be lower treatment initiation and retention among Black African American and Hispanic Latino as individuals. The bulk of evidence does not support racial ethnic difference in treatment-related symptoms reduction through findings are contradictory. Consider the intersection of race and gender is important area of for future studies designed to examine disparities in treatment completion-related outcome. Who should receive PE, prolonged exposure therapy? Individuals with PTSD or PTSD symptoms connected to a specific memory of a traumatic event that are distressing, interfering, following all types of trauma. This includes individuals with comorbid problems such as depression, other anxiety disorders, substance abuse, access to disorders, and dissociative symptoms. Is the client appropriate for PE? It's important, this question. Is PTSD the primary problem? PE is a treatment for PTSD, not a treatment for trauma. Is there any index trauma focus on imaginal exposure should be a traumatic event, not a general problem such as relationship difficulties? Is there a memory of the index trauma? A memory of traumatic event that can be narrated is required. Fragment memories with few details are okay as long as the patient can visualize and describe the trauma experience. Comorbidities that require stabilization prior to PE treatment. Imminent threat of suicidal or homicidal behavior, current serious self-injurious behavior, current psychosis, current high risk of being assaulted, other primary disorders or symptoms, severe panic disorder with agoraphobia, severe depression, dissociative disorder that make clients incapable of engaging in treatment. Commonly encountered questions in determining fit for PE: substance abuse, dependence, living or working in a high-risk environment, traumatic brain injury, personality disorders, complex PTSD, moral injury. It's important for us as a therapy and in you as a client to know that PE is a method specific for treatment of PTSD. It's very important to determine the success of the process. It's very important for us, so you as a patient, to know more about PE, how the method is, address ambivalence toward treatment and enhance motivation, identifying problem-solving likely obstacle to successful therapy. Difficult attending therapy sessions, find time to do homework, to work our logistics, session scheduling, audio recording, because the treatment through PE is very important for the client to join the treatment with high motivation. It's important to identify areas of life which I have been disrupted or are unsatisfying as a result of trauma, identify potential gains or positive change that will result from therapy or from reducing PTSD and related interference, identify patients' goals for treatment and how they can be achieved through PE. Or enhancing motivation for treatment is very important, like a discussion points to assess or enhance motivation, functional impairments, past PTSD treatment successes, barriers, possible symptoms increased during treatment, identification of barriers to treatment, transportation, privacy, time commitment, secondary gains, identification of gains from not participating in the treatment, and cultural considerations during the pre-PE preparation phase, like utilize pre-PE sections as additional time to build rapport, use this time to bring up conversation regarding cultural issues, discussing how racism can be affected in the development of PTSD, express humility and being open to learn about and respecting cultural difference. Acknowledge the possibility of race-related trauma alone can address this excellent experience and provide additional validation for clients. Why it's why it's important to assess for and acknowledge the possibility of race-related trauma. Clinicians must not assume all BIPOC individuals consider themselves a victim of racism. It may not be relevant to their index trauma. It's also helpful to address any racial issues between therapist and client if they are present. So, in the next video, I'll show you the method, the treatment program, prolonged exposure for PTSD. Thank you. And remember, if you'd like to have a section with me, please contact me, send a message through Instagram. And if you don't follow my channel, please subscribe here. Thank you very much. See you soon. Bye-bye.